Hello, everyone. Welcome. Tuesday, May 19th, 2020, the year of all kinds of entertainment in our world. I'm, of course, Bill Code, and you can see more about me at drbillcode.com, DRBILLCODE. And this is, of course, Kristina Mitts.
Hi, everyone.
My faithful accompaniment. And today we're going to talk about issues about COVID, of course, because that's been the bent that we've been on very much. And we are going to expand that over time. I think next time we've talking about some thyroid issues. Mm-hmm. And of course, I've got at least half a chapter on thyroid issues in my book, Solving the Brain Puzzle. And I'm going to extend that over because one of the implicated features with regard to thyroid is celiac or gluten sensitivity. So I think that's a really important issue for us to have. And many of you might think that, those are kind of long-term for COVID, but we're now in, roughly 8-10 weeks where we live here in British Columbia in Canada, but, longer in parts of the world and not quite as long in others. But the other thing I think suggestion is that maybe like the coronavirus will be a bit like the flu virus, it'll calm down in the summer months. Mm-hmm. And so then we'll creep back up in the fall. So one of the indications and suggestions for that, of course, is by fall, everything changes in the whole milieu around the world, including the microbiome or the microbiome of the soil and of the earth. And so partly related to that, we're going to be talking about this to some degree for the next year and a bit. Mm-hmm. Best estimate is by next summer, this will be all gone. Unrelated to whether we have a vaccine or not, but it tends to have a 2-year cycle on the planet. And so don't rush out and get your vaccine a year from now if it happens to be available, because you probably won't need it. So I think what I'd like to do is once again go over a bit about COVID, okay, the size. So COVID is a virus. A virus is a non-living piece of protein, okay? So we make it into a really bad guy, mm-hmm. as though it was thinking on how to solve or create problems for us in its own benefit. But it is a piece of protein, and at least roughly half of our whole microbiome is virus related, okay? And we always send and continue to our entire lives and our entire genetic history on the planet, the communication has been through virus particles. So this virus particle is transmitted around, it travels the world. Okay, how big is it? 0.125 microns, all right? So 7 microns is a red blood cell, all right? And I've talked about vessels that are in the 5 to 100 micron range. 100 microns is 0.1 millimeters. So 0.125 microns, it's a really important size concept for us, because if we had to pick, and this is partly from Dr. Zach Bush's interview with Del Bigtree, but in a credit to him, but if you look at all the way things fit together, it's not quite the way everybody's been thinking about it. We've decided that this probably traveled around the world on jet airplanes with people infected from one area to another. Well, that might well be the case, that it aggravates the features of travel that way, but the virus travels through the air currents, through the trade winds. So it was probably here, if it did originate in that subset Wuhan part of China or near it, and that's quite possible that it originated there. You can say where it originated from, that's a whole nother discussion, but it travels the world on the wind currents. And that's why whenever we do testing, whether it's here in Canada or part of the United States, as they've already done the testing in a couple of counties in California, they did it in Iceland, they find even in the asymptomatic people who've had no known exposure outside that part of the world, they find the incidence somewhere between 3 to 20%. Okay, the estimate I think in New York State is probably 20% of the population. Okay, so the virus is around all the time. And that's why it still mystifies me a huge deal that we're into lockdown. But the good news is, where we live, we're starting to soften the lockdown. But the tragedy is, people are still very, very fearful. I would like to help you reduce your fears with information, because we know that the likelihood of respiratory death, because it's talked about a great deal, this year is still considerably less than the very peak with influenza virus in 2017. Okay? We're still well below that amount. So this isn't going to kill almost everybody the way people worried it did. It killed 10% of us and all those pieces. We know now it's closer to 0.1%, maybe at tops 0.2%. Okay? So that's much less onerous. They're a little bit different, certainly from the flu of 1918, so just over 100 years ago, when millions of people around the planet, that virus picked primarily on healthy young people. This one, no, not at all. This primarily hits the elderly, the unwell or sick, and that's the primary group that it injures. And in that sick group, it's people with hypertension, heart disease, chronic lung disease, diabetes, and now we've added obesity, right?
Right.
So we want to reassure you, we're still somewhat in the first year of COVID-19. It's going to be a 2-year entity. I'm going to keep an eye on the questions if they pop up. And within that, we get to determine partly our outcome. So we talk a lot, you and I, about microbiome. This is a piece of the microbiome. Remember, viruses are a major component of our microbiome. And our microbiome is our entire body. And it's not totally unlike the soil microbiome, because that also has, bacteria, fungi, single-celled organisms, archaea, as well as viruses, okay? The same happens within us. We can shift our microbiome by what we eat and by what we avoid. We want to avoid antibiotics, and that includes, of course, glyphosate. That's not going to be super easy for some of you to avoid. You want to check your water source, and if you're in doubt about your water source, please put a reverse osmosis filter, $200 or $300, under the sink in your kitchen and drink only that water, because glyphosate is extremely water soluble. But remember, it's an antibiotic, and it also messes up your liver. One of the common things that we're seeing a threat of now, early signs of significant serious COVID, is raising your liver enzymes. So if you take away the liver poison of glyphosate and some of the other weed sprays or pesticide sprays that we interact with, you will really improve your liver health. And at the same time, you'll really improve your microbiome health. Microbiome health optimizes your immune system, because 70 to 80% of your immune system is based in the gut lining, all through the small intestine and so on. So every time you increase the variety of fresh fruits and vegetables, you're going to be better off, and you can do a significant shift to your microbiome in 2 to 4 weeks. Okay, you won't make it brand new, but you can make a significant improved shift. At the same time, it will reduce the tenacity or problems of your diabetes. Okay, so you're going to reduce that. You're going to reduce your troubles with obesity. And ideally, you would be optimizing your hypertension and reducing the problem with it. I'm not saying you're all going to get off medication. That's probably not going to happen. But you do remember, I said 1 pound of fat is 8 miles of blood vessels. So if you don't think your heart has to work harder, or if it's got more miles of blood vessels to pump through, please think again. It makes a big job. If the brain says it needs more flow for its optimal function, because it needs a lot of flow, because it needs a lot of oxygen, all of a sudden it tells the heart to pump harder and we get hypertension. Okay? But each of these, we can have an impact over 2-4 weeks and a huge impact over 3 to 6 months. We get to decide. So if you want to get over your anxiety, please, about COVID-19, feel empowered to do something for yourself and change things. Mm-hmm. So another big topic, of course, we're looking at opening up our Taymount Canada Clinic, under the recommended guidelines here in British Columbia. And so one of the things we talk about is masks, okay? So for people's comfort zone, and we'll live within the guidelines of using a mask, but I don't get really excited about masks the way most of us don't, because they don't make very much difference. Remember, the size of a virus particle is 0.125 microns. It goes through the mask without problem. Mm-hmm. Okay? And consequently, the masks aren't near as big a protection factor as we might suggest. We're going into the world of the plexiglass, aren't we?
Yes.
Plexiglass between the counters, but the virus, it's on small particulate matter. It doesn't have much fuss over plexiglass. You might think you're better off, but you're not. It's almost like the Get Smart days of Agent 86 and the silence cone. It's not foolproof by any stretch of the imagination. And remember, it's in the air systems, it's in the ventilation systems. And if you and I spent time, even in a huge garage, if we're there 3 or 4 hours, we're sharing the same air long enough that we share the virus to and fro.
Right.
Okay. So the virus is here. It's here in a lot of us already. I'm going to say 5 to 20%, and we'll start to get some more numbers, but we're getting pretty big numbers already. Several thousand in the study in California, several thousand in the study in Iceland, and many, many thousands or millions in the estimates that have done spot checking in New York State. The virus is here. It's lots of places. Lockdown. I think the biggest effect of lockdown, people aren't driving as much. So the air improves. Air pollution lets you predict where in the world they will be the most sick with COVID-19. Because the air pollution is a great carrier for the virus, but it also increases the irritability and the problem in the throat, nose, airways, and lungs. And those are the people who get really sick. So Wuhan and that portion of China where the air improved hugely. In fact, that was as probably big a factor as anything else. The air quality improved when everybody stayed home and they shut down the factories. So that's a whole different coin, but keeping the air pollution minimized. And that's probably one of the huge challenges that they had in Milan, in part of Italy, in the New York area. It's also pretty major. Apparently the same air quality problem in Seattle and Washington, USA, as well as down at the bottom of the Mississippi and Louisiana. And these are all problem areas for COVID-19. So we're lucky. It's a bit like living in Alaska. We live in British Columbia. We've got several thousand miles of Pacific air. So there's less particulate matter. I think the air from China primarily goes across in the trade winds more to the Los Angeles area than it does this far north. And so that's one relative benefit we have. We still have the virus, but we don't get near as sick because we don't have the pollution problem. So everybody think about how you can minimize the pollution long term. Mm-hmm. And whether that's driving your car, switching to electric, walking, bicycling, all good ideas. And ones that we're thinking about, certainly. Okay. So if the size of the particle that we worry about in air pollution is 2.5 microns, so that's 20 times the size of the virus, okay? So 2.5 microns will go all the way down into the bottom of the lungs. Anything smaller than about 5 microns gets really breathed in and down into the bottom of the airways. And then, of course, the other piece, and this leads a little bit into talking about the vascular thing, because one of our questions last time was about Kawasaki disease or illness, which is a childhood disease, is that it's the ACE2 angiotensin converting enzyme, but the ACE2 receptors, which are very prevalent in the nose and airway, parts of the mouth, certainly the stomach lining, small intestine lining, even the epithelial lining about the rectum, and they're very dominant through the lungs, of course, ACE2 receptors, and the other place, so they're everywhere in the body because they're in the lining of the blood vessels, the endothelium. And as a consequence, some people will be dramatically affected in that region. And that's maybe one of the reasons that the hypertension people are much more at risk, because most antihypertensives, especially the ACE inhibitors and the angiotensin blocking drugs, may aggravate the whole scenario because they up the amount of ACE2 receptors that you have.
Right.
So I'm sure I've had gaps in that. Is there things that you want to mention that we can maybe clarify things better?
No, that was pretty clear. I mean, we do have a question from Roger.
Mm-hmm.
He's asking, I have a dual water filter system, generic carbon filter, but also a chloramine filter. Is that enough to filter glyphosate?
No, it's not, unfortunately. You'll need a reverse osmosis filter pretty much to get rid of glyphosate. It's extremely water soluble. That means it's extremely bound. So that two-stage filter, unfortunately, won't do it. Yeah, so you're going to have to go an extra stage. The other option you have is you can send a water sample down to Great Plains Labs in Lenexa, Kansas, because they do glyphosate testing for people. You may remember that when I talked to Dean online, he had been visiting us from Australia, and now he's home in Australia, and we got his results on glyphosate after he got home, but his results were right up in there in the 97th percentile. And I've seen them in a young child in the middle of the prairies, also in the 96, 97 percentile. So glyphosate is used in a huge manner through almost all industrial farming all over the planet. So it's a kicker. It's a real problem for us. It's not as big a deal in Europe because they don't use it as much in their farming techniques, but it's very huge in most of the planet, not just for the GMO crops, but as a desiccant, as a drying agent, so you can harvest your wheat faster and all those other issues that it does. So if you're going to eat organic wheat, okay, better. And if you're going to eat organic potatoes and sweet potatoes and the sugars, because each of those are harvested with the desiccant or with the advantage of using large amounts of glyphosate, unfortunately. Yeah. So we can have a big impact on our well-being. And if you want to rely on supplements for part of your recovery process, please take vitamin D year-round. Adults over 30 or 40 should be doing at least 4,000 units a day. If you've got any absorption problems, like myself with sort of a gluten sensitivity, almost like a celiac entity, I needed a large amount, and now I can get by on about 7,000 units a day. And I get some sunshine too. But quite frankly, we live around the 49th parallel, and we only get 4 months of adequate sunshine per day. It's the same reason that the Black people in the United States, the African Americans, or in Britain, are 3 to 4 times at risk of problems with COVID because they have much less vitamin D. The darker your skin, the slower you make vitamin D.
Right.
Okay? And it's similarly, people from Pakistan and the UK, I guess they've got 2.5 times the risk from COVID. Again, because I don't think the UK is very heavily into vitamin D supplementation, and yet they're a tiny fraction north of where we are. Yeah, they're around 51, 52 degrees. So vitamin D is a huge factor which you can reverse in days. So you can start boosting it to 10,000 units a day for a month and then go to 4. And you will make a huge difference. If you want to be really careful about it, get it measured. You can get it measured by paying for it almost anywhere in the world now. But the short story is you need some, and if you're going to handle the problems of COVID-19, that's one of the least expensive ways you can go. And then you've got the whole other host of other things. You want to have some more vitamin C, you want to have more zinc in your diet. And those would be the big ones. I guess making sure that you've got vitamin A and E. But a multivitamin, multi-mineral will cover a lot of those bases. Maybe not all of them, but it'll cover them to a great start.
And then using our nutrition suggestions to boost your microbiome, especially the bifidobacteria. I was going to ask you a question about the vitamin D. So I came across some studies that were talking about how using a vitamin D lamp actually worked better than sunshine. What do you think about vitamin D lamps?
Well, vitamin D lamps will have that optimal component in it for making it. See, right now in Canada, because we're the 19th of May, we're probably making adequate vitamin D out there. I mean, the best time for vitamin D in any part of the world is roughly noon hour, okay? So you'll do several hours on each side of it. You still get sunshine in the wintertime, but you don't tan. You know, if you're really brave, you can go out in the middle of the prairies, be buck naked for an hour, noon hour, go make any vitamin D and you won't tan. You get really cold though. That we can guarantee. So if the vitamin D lamp will certainly work better than any of the winter sunshine that we have in Canada or the northern US or the respective other parts of the world. So that's when vitamin D lamps will do better. Okay? Because the sun is actually closer in the winter, and so intuitively you'd say that makes more vitamin D. But the reality is it's at a much bigger angle. So it's shining through the atmosphere of the Earth, and most of the ultraviolet key amounts are blocked. And that's the difference. And then vitamin D lamp will work better.
Yeah.
But there's a lot of other attributes to the frequency of the sunshine. Even on a cloudy day, an hour outside, a huge boost to your levels of how you're feeling, how you're optimally will rest at night, and all those parts. So sunshine is number one, but if you live north of the line between Los Angeles and Atlanta in the United States, part of the year you're not making much vitamin D. So we've shown it across the board with quite a number of illnesses. Multiple sclerosis is one of them. The further people are from the equator, the more problems with MS, because it's a vitamin D dependent illness to a great degree.
Right. Okay. Yeah. Well, maybe you want to start telling us about Kawasaki.
So Kawasaki, you know, I had to go and read about it. I had it mixed up with one of our questions last time. I think it was from Sandra, talked about Kawasaki. So Kawasaki's come into the news a little bit lately because it's had some association with COVID-19. So Kawasaki disease typically happens in young children, okay? It's reasonably rare, okay? But there was a nice report done by Dr. Brian McCrindle. So he's a Kawasaki disease researcher and cardiologist at the Hospital for Sick Children in Toronto, Canada. So, you know, quite a famous hospital. He did a good discussion about it because COVID-19 occasionally will have a blood vessel problem, likely due to this, you know, presence of all those ACE2 receptors in all the lining of the blood vessels in the body. And if those are flaring and inflamed and you've got reduced flow, then all of a sudden you may set up an inflammatory cycle, okay? And that is a tricky thing. So maybe another way to look at it, Kawasaki has an alternate name. It was initially described by a Japanese pediatrician in 1967, all right? The other name for it is mucocutaneous, so on the skin surface, on the mucus type surfaces, mucocutaneous lymph node syndrome, all right? So if there's a very unusual rash, and this can come on weeks after your go-around of COVID, then this is a possibility that it's either flared, a latent possibility that you're going to get Kawasaki, or maybe it's aggravating the Kawasaki that you do have. But if you've got any concerns at all about that, if you've got an abnormal rash and you have a fever of 104, which would translate to about 39.5. So a very dramatic fever for 4 days. Then start thinking about Kawasaki. See a pediatrician for your child, and if they need to, they'll move them on to a cardiologist, because 1 in 4 people with Kawasaki syndrome will have some cardiac issues. Okay. Because in the coronary vessels, the small vessels that supply the heart, they get aneurysms. They get little outpoachings of those vessels, and those kids can be quite at risk of heart attack, heart failure, and the whole scenario. And yet, if they get treatment and assistance with it, they can do quite well. The possibility of death is quite low. It's a 1%. It's still huge in relative terms, but it's, of course, a tragedy in a young child. So the key factors, and I'll read from them just so we don't miss any of them, as far as how you might be concerned about it and listen. So the high-grade fever, I talked about. Of course, redness of the eyes without a thick discharge, red, dry, cracked lips, and a red, swollen tongue, a skin rash, which we've kind of alluded to, swollen red skin on the palms of the hands and soles of the feet, and swollen lymph nodes in the neck. So obviously, when you've got a fever of that degree, sometime along the road, you're going to go and see a pediatrician, because it isn't just simple enough to treat it. And we've already talked about it, and people are saying, don't get excited and using low fever lowering drugs. If the fever is dramatic, get some medical attention with an expert pediatrician who can determine. And if there is components of Kawasaki syndrome, you need to be followed up really closely.
So people think that coronavirus is causing Kawasaki. Is that why this is coming up?
I think that was one of the concerns. I think what it may be actually is uncovering it or giving a case mimicking it.
Right.
Because there is an increase in rashes secondary to COVID-19. And most of us, if you look at a lot of the viruses that affect small children, they will get rashes much more than adults will. And I think that's because of their blood supply to the skin, rapidly growing, all of these pieces. And so that skin rashes are a bigger marker more commonly in children than they are in adults. And they can happen in the same illness, but look very different. So an uncertain rash, COVID anxiety, and the fever, get them checked out, because once in a while, you'll have something needs to be. The odds of this happening, fortunately, are really, really small. And yes, there's very occasional, but once in a while, children dying with COVID-19, but it's exceedingly rare, and most of them have some major health challenge in the first place before it happens.
Interesting. Well, speaking of the ACE2 inhibitors, have you seen any of the research on the herbal medicines that are good for blocking the ACE2 inhibitors from uptaking the virus?
Well, yeah, I think we're still at early stages. Quercetin is one of them, right?
Mm-hmm.
And so that's one that I have my shelf now. And I've got a good friend with really nasty lung disease. I've suggested she go on quercetin. So that's one of the bigger ones that I know of. That's what are there others come to mind for you?
Yeah, there's Chinese ginseng, and
Right.
There's Japanese knotweed, which is essentially the same thing as taking quercetin. That's why you would take Japanese knotweed, is for the quercetin, I imagine.
Yeah.
And then astragalus as well.
So astragalus, it's used a fair bit in Chinese medicine. I think the easiest one for people to find in most places will be the quercetin in a bottle.
Mm-hmm.
I mean, AOR, quality supplement maker in Calgary, Alberta, in Canada, they've got a great quercetin product. New Beginnings down in Lenexa, Kansas, they've got many people have quercetin, so it's a barely well understood, supplement. Yes, you can get it in herbal components, but I would be under the care of an herbal medicine physician or, a naturopath who's very comfortable in the herbs, or I would reach for a well documented, clean, healthy quercetin product off the shelf. Take a baseline amount. If you're worried you've got COVID-19, you might bump it up. And of course, the research that's being done on it, a lot of it's been done by Dr. Chrétien in Montreal, and they're doing a study currently in China on COVID-19 patients, and eventually they will have an outcome of that study. But quercetin is a relatively innocuous, safe, so it's a thing to take that you could take now, and then if you get sick, take more of it.
It's also helpful for allergies, so you get that bonus as well.
It seems to have almost like an antihistamine benefit.
It does, yeah.
Yeah, so that's, and today I would now prefer to use it for my allergy sensitivities than an antihistamine, just because it's got some other challenges with it.
Yeah, so at home I have quercetin, but I've also actually ordered skullcap, which is another one of the herbs listed by the studies I was looking at. Skullcap has the added benefit of helping it by breaking up biofilm related to Pseudomonas aeruginosa, which was related to the glyphosate.
Sure, yeah. Pseudomonas is one of the big problems. If you wipe out with an antibiotic, and that's what glyphosate is, unfortunately, everything else, then Pseudomonas, it's a tough little rascal. It tolerates glyphosate. So, yeah, so it's a useful piece to go to. Not unlike, I also mentioned another supplement you could take, CDP choline, or citicoline, as it's called in Europe, and it's called both here. I know AOR have some, and certainly New Beginnings has some. And what it does, it helps block the PLA2. Okay, so it's the PLA2 is the enzyme that's in the body, and that's what flares, and that's why you get really sick with a snake bite, spider bite, wasp bite, bee sting. It elevates PLA2, plasma lipase A2. And that is also one of the challenges that happens in COVID-19. And when the PLA2 goes up in the lungs, you get a relative cytokine storm. So that's why taking some of that supplement could help calm that. So make sure you've got the right one. CDP choline, or CITA, CITI choline, CHOLINE. And that's the one you want to go with.
I have a question for you. So the herbal research I was looking at was related to SARS. How is SARS different from COVID-19?
Yeah, well, they're really close cousins, okay? So COVID-19 is also called COVID-2, all right? COVID-1 was SARS. So SARS was a coronavirus, and that was 2002, 2003, disappeared in 2 years, okay? More people died from SARS, many more, than, in a percentage basis of those having it. We never got a vaccine for SARS. In between, I think in about 2008, 2010, we had MERS, which is the Middle East Respiratory Syndrome, which was also a coronavirus. And now we have this one. But I really want you to appreciate and realize this is really important, I think, for your long-term well-being and what you're going to do, what you're going to wait for. Okay? We've had coronaviruses in our population around the world for at least 30 years. In fact, they've been found as long ago as 1,200 years ago. All right? Every flu season, about 15% of all those flus that people get are a coronavirus. So we have coronaviruses routinely. The other subtlety that we've come to learn recently, of course, we've been doing flu vaccines. This is typically influenza A and B vaccines for 20, 30 years. And those are RNA viruses, as is coronavirus, okay? The tricky part about those vaccines is influenza viruses, much like COVID-19, mutates really rapidly and quickly, okay? The best estimates now that there are 30 to 150 different strains of COVID-19. That gets to be a challenge to make a vaccine, okay? Even flu viruses are a bit the guesswork of the previous year of the strains that you have, trying to predict where it will go. And they vary from, 5 or 10% efficacy, maybe up to 50%, but they've never been anywhere close to 100. The downside also is in growing these influenza vaccines in preparation for the vaccine, they've been grown on cultures of cells. And one of the common cultures that they use in the mix is that of dog cells. And dogs have a huge amount of coronavirus.
Interesting.
What it means is the influenza vaccine for the virus of influenza is often components that you're injecting when you take the vaccine. You're injecting components of coronavirus. No, it's not COVID-19, and it won't protect against it. In fact, it makes you more vulnerable to it. And it makes you more vulnerable by around 33, 36%. Meaning, if you've had the flu vaccine, now remember, I think I said before, I haven't had one for about 20 years. I did have them in the previous days, but not in the past 20 years. So I will probably handle COVID-19 better than someone, who's had their vaccine this year of the flu virus. So it doesn't give you any protection. In fact, it increases your risk factor. So we didn't change right away. When we started to get COVID-19, everybody was hyping up, get your flu virus, get vaccine. Not a great idea. Correspondingly, I'm not waiting till we have a vaccine. I'm really looking forward to getting through this virus. I would much rather have the full-bore coronavirus, because sometimes we make a vaccine like the H1N1 or the swine flu vaccine, and people get more sick, not better. So to speed up and do a warp speed vaccine seems a little risky to me, because often, remember, we don't have a great influenza virus vaccine even yet. We talk about it a lot. We really highly recommend it. If you're in healthcare, often you must take it, or wear a mask around where you work and so on. But have we done any favors? I'm not sure we have. So my personal choice, and you get to decide what you want to do, I hope. Mandatory bothers me a lot. But anyway, you get to decide what you will do in that virus milieu. We're going to have the virus anyway. It's going to be all gone by roughly the end of next summer. So in 2021, look after your health, look after your microbiome, and carry on is my suggestion.
Do we have any hypotheses as to why getting the flu vaccine makes us more, how does that work exactly?
I think the best suggestion is it has coronavirus components in it. And now your immune system, it has a response to the coronavirus. It thinks it's responding to the coronavirus when you get COVID-19, but it's not responding appropriately. So you can't deal with the new onset of virus near as well. And it's because, I guess you could say, your immune system's been somewhat tricked, but not tricked optimally.
Right.
There's certainly lots of evidence now. People are having the flu vaccine this year. They're not doing any better in the presence of COVID-19. And as I said before, they're tending to do somewhat worse.
Right. Well, I have seen some studies where they've seen that people who got the flu vaccine actually had a higher likelihood of getting the flu that year. So I wonder if it would be kind of similar.
Well, it is a bit similar, but I think part of it is that there's coronavirus components in many, many vaccines over time. Mm-hmm. If you're going to grow it in dog cells and dog cells are rampant with having coronavirus, then it's just not going to cut the mustard, and it's going to relatively trick the immune system, so you won't handle it as well. I mean, my personal guess is you will do better if you have the ordinary flu yourself than if you just get a vaccine against it, because it'll vary among people. Some people will do really quite well with it. Some people will actually get the flu from it. And, the list goes on and on and on. So I don't think it warrants what we're doing. We get really excited about it, and it's seen as a panacea. But trust me, how could we possibly make it at warp speed and we haven't been able to do it better for the influenza virus for 20, 30 years. Defies imagination. I mean, we're just not going to get that lucky.
Right.
And you can decide, how you can decide which one you want to take. You want to take the one they developed over in Germany and Denmark, in the United States, because it's going to be a changed virus by the time you get it exposed to it.
Right.
Yeah.
Okay.
Not easy.
I mean, I have so many questions about vaccines, but I don't want to push it.
Well, I think I'll probably, I've done some comment on vaccines. I am pro-vaccine if it can be safe and effective. But currently with the flu virus, it's relatively safe, okay? But is it effective? Not really. So if I need those two criteria, it's going to be hard to do. And it's going to be really hard to do in a hurry.
Right.
So my personal suggestion is really look at all the literature. If you want to learn more about it, you can go with The Truth About Vaccines, or you can listen to a very good talk by Judy Mikovits. You can hear her or other people. It's really well done. And Ty and Charlene Bollinger with their Truth About Vaccines. It's a really well thing. So have a look at that. You make your own decisions. We're all, hopefully, adults still get to make our own decisions. That's why I'm really looking forward to when they take the emergency measures off, because I'm not sure that emergency measures are indicated anymore. This isn't any worse. It's not as bad as the flu virus that we had in 2017. Okay, so losing our personal rights, putting us into relative lockdown, I don't think it's making very much difference. And I think, well, my wife was showing me today the plans of what they'll do in an airplane. So it's pretty interesting. People are being very creative. But please remember, the virus is around us all the time. And we are well composed of viruses. And that's one of our biggest information exchanges between us and within us. In a virus, it's like the messaging system. It's a little bit like the internet to us, really. They're around, and that's how we get genetic information, and that's how we developed and evolved over time. You can't stop the freight train coming down the hill.
I'm supposed to be putting together a presentation for the nutrition school again, and I was going to cover a bit more on just the microbiome through the perspective of coronavirus, this whole situation. And I came across some numbers that were showing that the viral microbiome is actually greater than the bacterial microbiome.
Oh, it is. Yeah. It's probably 50% of our whole microbiome. I think it's around 50. And bacteria would be around, I think, 30. And then fungi are a big portion. And then the single-celled organism, archaea, are a fairly significant deal. And all of these, are hugely overshadow the genetics we have individually and personally. Okay. So 50% of our entire microbiome is a staggering entity. And to think that we can manipulate within that with, go around of a vaccine, it's pretty optimistic. But we know if we can optimize the diversity in our own microbiome, so that's diversity of the viruses, the bacteria, the fungi, and the archaea, and we know how to do that. We eat healthy organic food, virtually no processed food, stuff without pesticides and herbicides, and especially without glyphosate, and we can get a much healthier microbiome. Vitamin D helps the microbiome a great deal. Sunshine, exercise, all of these are within your control. You get to decide and do them. And if anything, if COVID-19 will help us as individuals have a wake-up call. Let's concentrate on our health now. Most of us have had relatively more time on our hands. We're getting a little tired of Netflix or whatever. We've had more time on our hands, and when we have more time on our hands, we would be really wise to focus on our health and the health of our family. So people are cooking at home. It's awesome, They're running out of yeast and all kinds of different things that they're running out of. But if we can take the more time for our health, biggest piece is what you put in your mouth, quality of water you drink, and exercise. Get the body moving. It's made to be used.
I would say socialization as well, just while we're on the topic of things that impact the microbiome. It's actually quite important to socialize. So we pick up microbes horizontally as well. That's also how we build our diversity.
That's right. That's right. I read something the other day, 7 hugs a day, very good for your microbiome. Well, not many people have been hugging much lately,
No.
but I'm hoping we could get back to that degree of intimacy and interacting with others. We are social beings. I don't see any huge reason, that we can't make that more opened up again. Yes, we've flattened the curve where I live, but we're not eliminating the virus. At most, we're deferring by 2 weeks or 2 months when we get the virus. And I think we've already been through the initial go-round in most of Canada. It hasn't choked off our emergency departments and our hospitals. Most of them are low, and they're starting now, I think, in our place, they're starting to reintroduce elective surgery, okay? Because everything was just emergency only in case you get a big blow up the amount of serious COVID-19. And we've learned a lot about how to treat COVID-19. I think we're talking about a picture out of Brazil today, because it's got a lot of cases, and they've got people almost in a kind of a tent scenario with raised oxygen. So each of these pieces are useful. Jumping onto a ventilator was a disaster. We've learned the hard way with that now. And so it's not the be all and end all. Look after yourself early. Yeah.
Well, we have about 10 minutes left. So if you guys have any questions about the coronavirus or about things that you're doing to support yourself to be more resilient to the coronavirus, maybe you could just type those in now and we can answer them for you.
Yeah. I've got one question here, and I alluded to this a little bit earlier, but maybe didn't come out. How would the flu vaccine affect getting COVID-19? So if you've had the flu vaccine already, you probably have somewhat increased risk of getting a significant bout of COVID-19. So by roughly the numbers are a third, okay? So, and that's usually felt to be because the flu vaccine had components of other coronavirus, not COVID-19, but another strain. And this confuses the immune system, and that's why people tend to do worse if they've had the flu vaccine, okay? But you can't take the vaccine out if you've had it, so just get on with it. But I would focus a little harder on how you might minimize your problem with COVID-19. So get your other microbiome as healthy as you can. You can't change the fact that you had the vaccine already. So get yourself as healthy as you can. Get a hold of some quercetin. Make sure you take lots of vitamin D, at least 4,000 units a day for an adult over 30 or so. And if you're a child or have a child that's a year or older, I would put them on 2,000 units of vitamin D per day. 2,000 international units of vitamin D3. They used it a lot in Scandinavia, especially in Finland, for 30 years, and it had a lot of advantages in those children. They had less childhood cancers, less of them got MS, less of them got type 1 diabetes, and all of these other relative advantages by having adequate vitamin D, because these places like Canada are relatively far from the equator. And yes, in the middle of the summer, you're getting sunshine, but you're not getting it year round. And of course, the other kicker with all the anxiety about sunshine and skin cancer, all of a sudden people have been putting on SPF 30 or more, and that blocks 99.9% of your vitamin D formation. So please take it year round unless you can go somewhere. I used to volunteer to people, I'll write your prescription to go down to Mexico in the winter. You have to find a pharmacist that'll fill it for you, but good on you. Go get your vitamin D that way. Spend some time in the sun. And if you get 20 minutes You probably make enough in a day that will make 10 to 15,000 international units of vitamin D in your skin. But also the corollary, the darker your skin, the less you'll make vitamin D. And the older you are, the less you will make vitamin D. So particularly the elderly, for gosh sakes, if you're in a care home, I hope you're taking vitamin D. Even my mom was on some vitamin D in the care home, so full points to them. But people need to do it. We need to give it regularly for treatment. So the flu vaccine doesn't protect you against COVID-19. In fact, it will somewhat worsen how much you experience with it.
Mm-hmm. Unless they can come up with a way where they can guarantee that it's been excluded from these coronaviruses, I suppose.
Yeah, well, it's going to be hard to exclude it because we've been growing on those types of cells for a very long time.
Right.
We've got another question. What's my theory on the future COVID outbreak, or what is called the second wave? Well, it's interesting you asked that, because as I thought about that over the weekend, because there's been more and more coming about this second wave and what's it going to be due to, the premise thought is we're going to worsen that because everybody's going to be out interacting, and now we're going to get the second wave. One of the other things that's changed, and it changed here even this weekend, because we drove around some on the weekend, visited friends a couple of hours away, is the amount of cars is going up like a rocket. All of a sudden, the air quality goes down. More pollution, more problems with COVID-19, and I suspect that, if anything, will create the second wave. The other second wave premise is that we're now into summer, and of course, flu viruses tend to really back off in the summertime. It's a superb idea to get outdoors, okay? So I'm not sure about the number of people meeting outdoors, but outdoors, I think the major look at it in China, 0.3% of COVID interactive catching from others outside, almost none. Why? Because the air moves around freely, and what I talk and breathe out is very different inside than if we're talking outside. Mm-hmm. So maybe we can get back to having outdoor concerts. I'm not in control of that anyway. Gosh, maybe we can get back to having baseball games in the summertime. Who knows? But it's time we really look seriously at that. I'm not truly convinced personally that the second wave is going to be such a big deal. We've been through the first round, and countries like Sweden and countries like Taiwan, they haven't locked down near as heavily, and I don't think it's going to vary near as much as we suggest it will. I know we're very anxious about it because we don't want it to get really bad. But remember, even in the worst case scenarios in the parts of the planet, 0.1, occasionally 0.2% of people get desperately sick and die from COVID-19. Mm-hmm. So if you don't have any other health challenges, even if you're older, I've got a great couple of friends. They're 79 and 80. They've had COVID-19. They never had to go near the hospital, okay? Just because you're old doesn't mean it's bad news. If you've got a bucket of problems health-wise, obesity, diabetes, hypertension, maybe heart disease, well, you're a risk. I get it.
Yeah, I thought cancer was part of the risk factors as well.
It is, yeah.
Okay.
And the cancer probably is due to the blunting of the immune system, especially if you're on a chemotherapy agent, because all of those things, unfortunately, blunt our immune system, so it can't work as well. And the other group would be, and sometimes in cancer, people are on a corticosteroid, as far as the treatment of leukemia and the treatment with the chemo. And yeah, for sure, they're more at risk. Okay, vitamin D if having a shower right after. Well, the vitamin D changes below the surface of the skin as we make the steps towards taking sunshine. It happens below the surface of the skin. So you won't be washing off your vitamin D with a shower. So that's good news. You can stay smelling good and not wash off your vitamin D.
Does COVID attack the brainstem, i.e. the autonomic nervous system?
There's some suggestion that it can. Early on, we were talking about the occasional person. It seemed to attack the brainstem, and that was part of the feeling behind some people died from it. by attack of the brainstem. So what's going to aggravate the attack on the brainstem? One would be an unhealthy microbiome, and now things are traveling up the vagus nerve. But a more likely one would be if you've got a major problem, and if you wear a mask all the time, what does that do? It concentrates the virus because you're not breathing it out the way you normally would. Okay? So it's concentrated in the area of the nose and the sinuses, and it's a very thin distance across the so-called cribriform plate up into the brain. And that's maybe one reason I personally won't wear a mask if I can help it. I know all about wearing masks. I mean, I spend many, many years in the operating room wearing a mask almost all the time. Okay? They don't stop viruses. Remember, they don't stop viruses getting in. They can't. They will reduce the droplets. If I sneeze or even if I speak with the mask on, some of the droplet will be reduced, but the virus is in the room already. Okay? But the feeling about masks, and of course, if you've got respiratory problems and now you're wearing a mask, two things happen. You're concentrating all the bacteria. Instead of breathing them out, they're all getting concentrated in your airway and in your lungs. So that's going to aggravate the feature. The second feature, and this was well talked about by Dr. Blaylock, or a neurosurgeon, is that when you put on a really major fitting mask, and this would be probably the N95, the standard, you are going to reduce your oxygen in the body and raise your carbon dioxide because you're not ventilating as optimally through the system.
Right.
And so that's why I'm not crazy about masks. And so my concept, if I need to, I'll put on a cloth mask. So I'm, going with the guidelines appropriately, and leave the fancy N95 masks to the healthcare personnel.
Mm-hmm. Well, I can think of other things that you would do to help promote the exhaling or the movement or the opposite of the concentration of the virus through the sinuses. So would you say if someone were in one of the more susceptible groups, would it be appropriate to do things like breath work, to do types of exercise that got you breathing more heavily?
Yeah, absolutely. I mean, the exercise will make a difference, and it'll let you breathe deeper. Techniques of breathing deeply are really good for us. I mean, it's a huge problem in folks with MS because most of us will sit in a chair and we won't breathe deep hardly ever. And it's small wonder that most of us end up eventually dying from a pneumonia. And so optimal breathing really makes a difference. And also remember, if we get the microbiome healthy in our gut, the microbiome is healthier in our lungs.
Right.
And so that even though you've got a few of the so-called nasty pathogenic bacteria, maybe you've got a little bit of salmonella, or you've got a little bit of prevotella, or you've got a little bit of pseudomonas, as long as all the other healthy ones are there and you've got that great diversity, they don't become a problem. And they don't become a problem unless there's a secondary problem. We talked much earlier on about the one that seems to like to really live with COVID-19 was prevotella, which can be there if you're gum disease, can be there in sinus, nose infections, and in lung infections. And that is the ones, it's that secondary infection that sometimes the antibiotics are actually going to help. They're not helping the virus itself, but they're helping some of the co-infections that are the problem triggering the pneumonia.
Right. Okay, well, that's it for questions, and we're at 5:02. So
There we go. It's that time. So, as we mentioned, we're not going to do this on Thursday this week. Everybody's hopefully getting back to work or getting back to what they want to do in their life. It is now the new normal. And so our new normal concept, and Kristina's going to ask you, through my Facebook and other sites, what time works best for people. Happily, this is recorded, so you can go on to Facebook at a different time of day. You can't answer the questions, but you're welcome to put in questions and we'll ask them next time. Unless we hear otherwise suggestions from you, we will probably do this the same next Tuesday at 4 p.m. Pacific Daylight Time. But let us know. And once again, tell your friends or contacts about this podcast, but also that if they're not on Facebook, and I know not everybody's on Facebook, I get it, they can go to drbillcode.com, DRBILLCODE.com, and click on the blog, and they've got a listing there of those, the ones that we've done on Facebook, and others that I've done with my colleagues at Point of Return with Alexander Ray.
So just to reiterate, we're going to continue doing these Facebook Lives on Tuesdays, but I am going to make a post on Facebook just asking you guys what time works best. And then if you have any topic suggestions, please write those in the comments as well, and we will take those into consideration.
And we're tentatively thinking next week will be on hypothyroid or thyroid issues and or some input on celiac.
Okay, well, that's it for today. So signing off, we will see you next Tuesday.
Stay well, get out in the sunshine. It's a wonderful day here.